Good morning, and thank you all for being here today for our last hour in Neurobehavioral Sciences Psychiatry. I want to first say what a pleasure it is for me to be here, and I want to thank you all for, again, this honor of being asked to present for this week in psychiatry. I want to thank Dr. Elliott for all his graciousness throughout the week and throughout the year, and for everything he does and everything he allows and provides for me. And I'd like a round of applause, please, for Dr. Elliott. And I want to thank all of you for being here, for coming to class, and for participating, for the questions that you asked. They were very astute in helping to guide me as well and providing information that will help you all. And as we bring psychiatry together, a couple of things that are so important. We as DOs have unique skills in that we not only interface with our patients face-to-face, we are honored in being able to treat them with our hands as well. And one of the keys that we utilize is energy. And energy allows us to intervene manipulatively. And I thought we'd do some demonstrations of that here this morning as well. What I'm going to ask, if I may I ask, and this is perfect because you all are right here, so I appreciate that. And I want to know, can you all see, it would probably be best if we perform this demonstration from here on the platform so all of you can see. And if I may I ask, please, for you two to come forward. May I do that? Please, a round of applause for What I'm going to do, I want to demonstrate this concept of energy, human energy. So I'm going to ask, if I may, your first name is? Delaney. I'm Dave. Thank you for coming up. I appreciate this. Nice to meet you. And your first name? Katie. Thank you as well. I'm going to ask each of you, if you will, first, with your left hand, I'll just have you grab hold of that. Perfect. And now, with your right hand, I'll ask you to grab hold of this hand. Now you'll notice nothing happens. And yet there is energy between Delaney and Katie that is flowing right now. And now I'm going to ask you both, if you will, down low, just touch fingertips, index fingers. And you will see the energy that flows. And you may undo the index fingers. And now I'm going to ask, if I may, for two more volunteers, please, to come forward. And you may stay at ground level as you come forward, because now I'm going to ask each of you to do one on each side. I'm going to ask you to touch fingertips. And then nothing happens yet. You're right. You're ahead of me. Because now, as you two touch fingertips, you will see the energy that flows. First, a round of applause. I want to thank you all. And thank goodness no colleagues were injured in the making of this presentation. We could take everyone in the room and circle the entire room until we touched fingertips at the end, and that energy would flow and actually be magnified. Energy, it is who we are. It is what we do. My energy flows through here. Energy. I'm going to ask you now, if you will, to clear your mind. Just take a moment, take in a deep breath, and then slowly exhale. And this is what we do in between patients, so we clear ourselves, so that we present to each new patient refreshed, renewed, allowing each patient we see, whether at the beginning of the day or at the end of the day, to sense and feel with all sincerity as if they are the most important patient presenting to us that day. We are not fatigued. We are not overwhelmed. We allow that energy to clear from us and have renewed energy. Piece of wood, a block, 2 by 2 by 6. Long ago in a galaxy far away, this was vibrant and alive. It was a tree. What is it missing now? One of the key elements it's missing is water. Substance of life. What I'm going to ask you all to do now, if you will, is to harness the energy that exists within you, the positive energy. Because we are going to attempt an experiment. I'm going to take this block, gently tip it against this bottle. And I'm going to ask you, it's an experiment, we'll see how well we can harness the energy, because I'm going to ask you all now to take the positive energy you have within and to focus it onto the bottle, to excite the molecules within that bottle, so that hopefully we can generate some energy within there to bring a moment of excitation to that piece of wood again, so maybe we can see it move. Maybe we can get some motion from it. This is an experiment. We'll see. Please do not work so hard. Excellent. Please give yourselves a round of applause. Energy. When we think about energy, we think about healing energy. The energy that we as DOs infuse into our patients through our manipulative skills. Inside this gold bag, I have 5 globes. 4 of the globes are silver. One, the black one, has gold inlay, so that it is incredibly tuned to absorb energy. I'm going to come around here. I'm going to place the globes back into the bag. 4 silver globes, 1 black with gold inlay globe. And what I'm going to do is ask, if I may I ask you please, without looking, to reach into the bag, and I don't want to see it, I want you to reach in. Without looking, grab 1 globe, hold it in your hand, and then hand it back the bag so that no one knows which globe you selected. And then I'll have you arise. I'll have you stand up, please, before time and in these days. Very good. And I'll have you hold up your globe. Now I'm going to ask, please, if you will, I'm going to have you do the same. I'm going to have you take the bag without looking. I'm going to ask you to reach into the bag and remove a globe. And I'm going to have you hold on to it. I'll take the bag back. I'm going to ask you, please, if you will arise as well and hold on to the globe and hold your arm out, if you will. Perfect. And then we come here to the center. And may I ask you, please, to do the same. I'm going to have you take the bag. I'm going to have you reach into the bag and remove the globe. I don't want to see the globe. Please keep it covered. Keep the globe covered. I don't want to know what the globe is. Nor do I want anyone else to know what the globe is. Very good. I'm going to have you please stand up, if you will. Sorry. I'm going to have you please hold your arm up with that globe. I'm going to ask you please to reach into the bag, remove the globe. I don't want to know what it is. I don't want anyone else to know what it is. And then I'm going to have you hold the globe in your hand, hold your arm up in the air. Very good. And then we'll come over here. And I'm going to ask, may I, young lady, may I have you please take the bag? I'll have you remove the last globe. And then I don't want to know what it is. I don't want you to know what it is. And I'll take the gold bag back. A little alliteration. Thank you. I'm going to have you stand up, please, too, if it's okay. And I'll have you hold your arm up again. What we're hoping to do, I infused earlier healing energy into the black globe with the gold inlay. The healing energy of osteopathic touch. And now what I'm going to do is seek to feel that energy, because I'll get it back from you in a little bit. However, in a moment I'm going to ask you to open your hand and reveal that you do not have the black globe with the gold inlay. You have instead a silver globe. Would you please turn your hand over and show it is in fact the silver globe? And you're holding the silver globe. How did I know that? Because I saw it. So now we have 3 globes left. And in fact, this helps illustrate when a patient comes in the middle of winter, and he or she is side bent right and rotated right. We can just about bet they were shoveling snow. We can tell by the way they walk in, and so they're in a non-physiologic position. 3 more globes. I can sense before you open your hand that you're holding the silver globe, the last, not the black with gold inlay. Would you please turn your hand over and show the silver globe? And now we have 2 globes left. And before either of you open your hands, I'm able to tell you now that it may be a few more years before you have osteopathic training, because you're holding the silver globe and you have the globe infused with healing energy. Would you please show the black with gold inlay? Thank you very much. Thank you. Energy. When we think about energy, we realize energy infuses everything that we do. And we realize that when we intervene to treat patients, thank you, we treat with different techniques. We treat with medication, pharmacotherapy. We treat with psychotherapy. When we treat with pharmacotherapy, numbers are important. Doses are important. We're going to look at some of these numbers now. I have a box with a die in it, and the die has numbers 1 to 6. It is a typical die. It is made out of wood. And I also have bingo cards, and they are comprised with numbers. And the bingo cards are comprised with numbers from approximately 1 to 47 on all of their cards, all in random order. May I hand you this box? It's a wooden box, and please open it and look, and you will tell us. You may take out what is inside. Please show it to all present. It is, in fact, a die, a wooden die with numbers. Now, in a minute, I will turn away. And when I do, I'm going to ask you in a minute to take the die and to put the die into the box. And I'm going to ask you, please, either to remember the number on top or the number on bottom. And then I'm going to have you close the box so there's no way I can see in. And I will turn my back, not to be rude, nor to blind you with the light bouncing off my balding pate. I am going to turn my back so that please you may show the number to those around you. Okay? I do not want to see it. So please, if you will, I'm going to have you turn the die, put in whatever number you want.
Okay.
And you have it, yes?
Yep.
The box is closed. And do you want me to be thinking as you are thinking about it of the number on top or bottom?
Bottom.
Okay, very good. I want you to concentrate on that. I have bingo cards. And now I'm going to ask you please to think of any number from 1 to 47 silently. I don't want to know what it is. And once you have your number, I just want you to say, Dave, I have my number. Excellent, because now I'm going to ask, please take your time. Do you see your number anywhere on that bingo card? Yes. You do. Very good. Do you see your number anywhere on that bingo card? Okay. Do you see your number anywhere on that bingo card? Do you see your number anywhere on that bingo card? Do you see your number anywhere on that bingo card?
Yes.
Okay. And do you see your number anywhere on that bingo card?
No.
Okay. You're thinking of a number. You've got a number. And the key is that when we make an appropriate diagnosis for a patient and we intervene to treat with medication, we want to be very aware of the number. We want to be certain that we dose accurately and correctly. And I believe that you're thinking of a number right now, randomly. You thought of the number 17, is that correct? And you put a die into a box face down. And the number you put in reminds us that when we dose, we may do so once a day, QD, twice a day, BID. We may do it 3 times a day, TID, or we may in fact do it QID number 4. Is that correct? Thank you very much. Thank you. When we think about treating and we think about pharmacotherapy, psychotherapy. When we think about psychotherapy, we realize that psychotherapy is very powerful. In essence, it is psychiatric surgery. It is bloodless, we hope. However, it is no less painful than any type of surgery. The difference is we do not get to apply anesthesia. We are going to attempt to illustrate the potential risks of psychotherapy here today. We have here 4 small holders and a 5th, and inside the 5th holder is a spike. And I'm going to ask if any of you here in the front would like to come forward to gently touch the tip of the spike to verify it is in fact a dangerous instrumentality. Very good. First I'll have you hold your hand out so I may set it in so you may verify the weight. It's solid, it's heavy, is it not? And now I'm going to ask you, if you will please, to very gently touch the tip. Would you agree that's very sharp? May I ask your assistance now, may I bring you around onto the platform? Thank you. And your first name is? Andy. I'm David. Thank you very much. A pleasure to meet you. Please, a round of applause for Andy. In a moment, I'm going to ask you to do something without any fear of risk to you. In a moment, what I'm going to ask our colleague Andy to do is I'm going to ask you, please, and you may do this however you want because I will step away so my back is turned so I cannot see. If you would like to mix these by doing this, that's fine, and then cover them. If you would rather mix them covered so that no one really knows where that spike is, you may do that as well. It's whatever you feel most comfortable doing with our assemblage today. I will ask this, that after you've assembled them, that you leave these distance in between So there's plenty of distance in between these. And if you would even rather do this, please with great caution. If you would rather do this, and then cover, that's fine as well. It's whatever you're most comfortable with. Keeping space in between. I will turn my back, again, not to be rude, allow myself a sip of some liquid, and I will turn my back. And when you're ready, and they're covered, and here in line, I just want you to say, Dave, we're ready. Very good. Turn away, so I cannot see where our very brave volunteer is putting this. When you're ready, please just say, Dave, I am ready.
I'm ready.
All right, very good. Andy, thank you for your kind assistance. Yes, thank you. What I'm feeling for is the energy. The energy that, in fact, Andy imparted when she held that spine. When we engage in treatment for our patients, when we engage in psychotherapy, or psychotherapy combined with pharmacotherapy, our key is to bring about for our patients the greatest amount of benefit without side effect. And I'm glad that I'm in an assemblage with physicians in case this goes awry. And I hope and trust you've already had your surgical rotation class, at least. I see head shaking no. Now I am beginning to feel my autonomic nervous system activating. When we think about treating with psychotherapy, it's very important that we determine what type of psychotherapy with which we will engage the patient. And it may even change from time to time, because the psychotherapy in which we may engage on one day may be a high-velocity, low-amplitude type of therapy where we are confronting the patient. We may then engage in a supportive type of psychotherapy where, in fact, we are utilizing an indirect technique, allowing the patient to go in the direction he or she so wants. And then it becomes important for us when we engage in the therapy, at times, to take the patient up to the barrier of the intrapsychic conflict, hold them there, and then release them in a muscle energy type of approach. And in fact, our goal is to achieve the appropriate therapy at the appropriate time. When we think about treating, we oftentimes engage in a process of collegiality. We collaborate with colleagues. We want to engage in this process. We also want to establish rapport with the patients, and we want to get a sense of this feeling with patients that is akin to synchronicity. We get a sense of the direction they're going, so that we know which way to go with them as the treating physician. Bless you. Earlier today, I asked someone to think of a month and a day. I merely asked them, please think of a month and a day. A deck of cards, from which I will remove the jokers. I will shuffle these cards so that hopefully these cards are thoroughly mixed. And now I'm going to ask, if I may, May I ask you please to come forward? Is that okay? And I'm not trying to take advantage of the folks in the front row. It makes it easier as you're present. Would you agree that these cards are thoroughly mixed? We just shuffle them. Yes? Would you like me to give them another shuffle? Sure. All right. We will do that. I will use my leg as the table. And now I am going to ask, if you will, I just want you please to say stop at any time. I'm sorry. Okay, very good. It's hard for you to riffle. Please say stop at any time. Very good. I'm going to have you hold your hand out, please, because I'm going to remove the card at which you stopped me. I don't want to see it yet. And I'll have you put your other hand on top. You could have had any card, and that, in fact, is the one to which you went. Holding onto that card. I asked someone to think of a date earlier, much earlier this morning. Would the person for whom I asked that please arise? Excellent. And you thought of, please, a round of applause. I asked you to think of a date, just a month and a day, is that correct? Yes. And you did. Totally at random, I have no idea what it is. I did hand you a calendar, a book, is that correct? Yes. And it has a rubber band around it, so there was no way anybody could get into it. And I'm going to ask you please to remove the rubber band at this time and to open up that calendar. And what you're going to notice about that calendar is something very unique. Every day in that calendar has next to it, handwritten, a playing card. Is that correct?
Yes.
And the playing cards are in there at random. I have no idea what date you picked. I'm going to ask you, if you will, please, to share out loud with everyone in the room right now what month and day you picked.
November 28th.
November 28th. Now I'm going to ask you please to turn to November 27th. And I'm going to have you please tell us what card is handwritten at that location.
Queen of Spades.
The Queen of Spades. Now, you said November 28th, is that correct? Mm-hmm. So I'm going to have you please turn to November 29th and tell us what card is handwritten there.
Four of Clubs.
The Four of Clubs. So, had you picked any other date in that book, it would have been any random card. However, you selected the 28th of November, and there is a card written there, is that correct?
Yes.
Would you please share out loud with us what card you randomly selected by picking a month and a day? What is the card that is handwritten there?
Nine of Diamonds.
The Nine of Diamonds. We shuffled the deck several times. We had a colleague stop at random in the deck and remove a card, and we're looking to see if we have synchronicity, the connectedness between two individuals. And I'm going to ask now, would you please open your hand, show us the card, and state out loud what card you selected. Nine of Diamonds. Thank you. Patients, when they present to us, are unique. Each patient is different from every other patient because he or she is who he or she is. We're going to attempt, at this point in time, to look at this concept of the uniqueness of patients. In my wallet, I have a stack of $1 bills. And I'm going to split the $1 bills into two packets. So that there are actually $15 bills in each packet. And I'm going to if I may, I will hand one packet of dollar bills. May I give these to Mr. Warner? Dave, I'm going to ask you to take those face down and just shuffle them up. Go ahead and shuffle them up, mix them up, and I'm going to hand, if I may, a stack of $1 bills, 15 to be exact. I'm going to hand you these face down. I'm going to ask you, please, to shuffle them up, mixing them thoroughly. And then I'm going to ask you, please, and I'm going to ask Mr. Warner as well, please, after you've shuffled them thoroughly, I'm going to ask you to remove a single dollar bill and hand me the rest. Now keep it please face down so that no one knows, and I have no idea what you selected other than a dollar bill. And I will do the same with Mr. Warner. Thank you.
14, I want you to know.
Oh, okay, I'm short a bill. No, is there 15? Good, good. My last show, somebody kept a bill. No. Now, dollar bills are unique in that no $2 bills are alike. Every one has a different serial number. And each serial number begins with a letter, ends with a letter, and has a series of numbers in between. 2 $1 bills selected at random. We're going to make this even more difficult. I received back $14 bills from each of you. That leaves us 28 $1 bills. So I'm going to hand, if I may, the 28 $1 bills that are left. And I ask you to shuffle those up face down, please. Mixing them thoroughly. And I'll have you just take one face down, put it onto the desk, and hand me back the $27 bills that are left. Thank you. And now I'm going to ask, if you will, those of you who have dollar bills, you may turn them face up to yourself now so that you're looking at the serial numbers, and those around you may look with you so that they can verify. Absolutely. Thank you. Yes. So they can verify. And I'm going to ask you all now to concentrate on the dollar bills, on the serial numbers, because this is what we do. Yes.
I forgot my glasses.
Those with you will verify. Not to worry. That's okay. This is similar to what happens when patients present to our practices. They're different. Each one is unique, and we as physicians have to understand by utilizing our interview so that we understand their symptoms. First we look remembered age, then gender. Then we look at the symptoms. We look at the onset of symptoms, the frequency, the duration. We look at family history. We want to assess genetic predispositions. As you look at these dollar bills, please focus and concentrate, because the dollar bill in the center that you're looking at, and please, if this is good, I want you to be excited, starts with the initial, the letter G. Yes, and then, and please, as you concentrate and see it in your mind over and over, as you're making your connection with your patient, you are then getting a 1 and a 0 and a 3 and a 0 and a 1 and a 9 and a 2 and a 2 and an E. Is that correct? Yes. And you all are getting the impression of a patient with an A and a 0 and a 6 and a 0 and an 8 and a 1 and a 9 and a 4 and a 9 and a G. Is that correct? Yes. And in the back, you're looking at a dollar bill with a serial number that starts with a D. And then it goes to a 0 and an 8 and a 3 and a 1, 1, 9, 5, 1, G. Is that correct? Correct. Please, a round of applause for all. The uniqueness of the patient. It's so important for us to keep that in mind, because it becomes all too easy for us to feel as if we know everything there is to know, and we don't. And every patient helps us to learn more and more about how we practice our medicine. And with that being the case, another important concept when we are treating patients, when we are working with patients, deck of cards. We mix the cards thoroughly. Now, may I ask, may I have you come forward? Is that okay? Thank you very much. Please, a round of applause for your first name. Greta, Dave, thank you for assisting. I really appreciate it. I'm going to ask you please to say stop at any time. Very good. Please, without looking at it, I'll have you remove the card where you stop. I don't want to see it. And I'm going to take the deck of cards, placing a rubber band to, in fact, around the deck, so that now I cannot get to the cards. I'm going to hand the deck out, and I'm going to ask 5 individuals, if they will, when they receive the deck, to take the deck, put it into their hand. With their other hand, come over, pick up a grouping of cards, look at that card, remember it, drop the cards back down. Okay? So, if I may, I will come down and hand you the deck. And I'm going to ask you, please, just to open the deck, look at one card, let it drop back, remember that card, and I'll take the deck back, and please, if you'll rise, I appreciate that. I'll have you stand. And then I'm going to we'll come around. May I ask you to do the same? I'm just going to have you take the deck, open it, look at a card, drop the deck back down, remember that card, that one card, and I'll have you have your deck. And you're doing fine. And I'll just have you stand up. That's perfect. You're doing great. And may I ask you to do the same? You take it, pop a card open, look at it, drop it back down, and remember. And then, may I ask you to do the same? Remember? Very good. We have 1, 2, 3, 4. I think perhaps a 5th would be in order. May I ask you to do the same? I'm going to have you take the deck. Please, pop it open, look at a card, drop it. Perfect. And please remember. Now, I'm going to ask you all to picture the card in your mind. I ask you please to think of it over and over, creating an image. And as you do, my role as an osteopathic physician through palpation is to sense and feel what's going on in the patient's body. As a psychiatrist, my role is to sense and feel what the patient is thinking, and through therapy, get a handle of what's going on in the intrapsychic conflict in the unconscious mind. In a moment, I am going to call out your 5 cards. Please do not do anything until I then advise you on what to do. Okay? 3 of clubs, 5 of diamonds, 8 of spades, Queen of hearts, 9 of spades. If I named your card, please sit down. Thank you. We have one card that was selected at random from the shuffle deck. And this reminds us, patients present to us as if at random from a shuffle deck into our schedule book. And it is very important that when we engage in the practice of medicine, that we do so logically, coherently, with good science, with good understanding of the medications and the mechanisms of action, that we understand potential risks, side effects, benefits, and med-med interactions when we practice medicine. We need to know our pharmacology. You need to know our pharmacokinetics, our pharmacodynamics. These are also important. And it is also important that we obtain informed consent from our patients before we intervene in any treatment approach. We have to express potential risks, side effects, benefits, med-med interactions. Because if we don't do that, just as if we perform and practice magic and mentalism cavalierly, we most definitely need to have one of these. This is my magician's insurance policy. As physicians, we need to have an insurance policy as well. My policy says all individuals involved must be playing with a full deck. We are. I must add as an aside, the most common contract entered into in the United States is the insurance contract. The least often read document in the United States is the insurance contract. Please be certain that when you all go out into practice, that you read your employment contract fully through, and that you read your malpractice insurance policy fully through, so that you know exactly what the terms and conditions of your policy are. Because hopefully, this is going to cover my practice of magic and mentalism. Would you please tell us what card you're holding? The King of Hearts. Would you please show it to all present? Because hopefully, our insurance policy covers exactly what we need as well. Thank you very, very much. It has often been said, never judge a book by its cover. I actually buy books based upon their covers. The Dream of the Accused reminds me, Freud said, the royal road to the unconscious, dreams. The Ultimate Flashback, remember we talked about acute stress disorder, post-traumatic stress disorder, the life-threatening event that causes horror, fear, helplessness, even a sense of hopelessness that now causes symptoms in an individual that if they last from 2 to 30 days in the DSM-4 TR, 3 to 30 days in the DSM-5 of nightmares, flashbacks, daytime revivifications, traumatic amnesia, that in fact we're looking at post-traumatic stress disorder when it goes beyond the 30 days. The ultimate flashback. Del Shannon's Mysteries reminds us that so much of what we do in medicine is still a mystery. I remember my first day of medical school, August 31st, 1987. Professor Dickey said to us, the very first presentation to medicine, 50% of everything that you're taught in medical school will be proven wrong in your lifetime. We just don't know which 50%. It's all a mystery. Death Wish reminds us. My hero, Charles Bronson, who starred in the Death Wish series. There were so many of them. I think the last one was Death Wish meets Rocky to be the Planet of the Apes. Death Wish reminds us how serious psychiatric illness is. And that in major depressive disorder, 10 to 50% of patients will successfully suicide in their foreshortened lifetime. Bipolar disorder, 1 in 2 will attempt suicide at least once. 10 to 15% will succeed and complete. Schizophrenia, 1 in 2 will attempt suicide at least once. 10 to 15% will succeed. Serious illnesses with serious end results. It's so important that we ask our patients if they're having any suicidal thoughts. Remember, there's only one question you get to ask a patient at all. It has to be about harm. Harm to self, harm to others. Death Wish. Webster's Dictionary reminds us how important it is that we discuss with patients their medical issues in terms they understand. Yes, when we're home on break, it's great to impress our family and friends and neighbors with all these giant words we learn in medicine. We're not out to impress our patients. We're out to help our patients, to treat them. Webster's Dictionary reminds us of this. And fatal sins reminds us the single greatest fatal sin we want to avoid is failure to obtain informed consent. We always ask of patients, do they understand potential risks, side effects, benefits, med-med interactions before we intervene? And do we have their permission to do so? I have many books here. I will come around and I'm going to ask if you feel comfortable enough with your vision, and I will utilize one of the books with you. I don't want to embarrass anyone. And thank you. I appreciate the openness and honesty, if I may. May I hand you this book, Fatal Sin? And I'm going to ask you, if you will, please to tell us how many pages are in that book. You need not be psychic, you may turn to the last page. How many pages are there?
280.
280 pages. I'm going to ask you to allow me the poetic license to say 300 pages. In a standard Gallic proof of a hardback book in the United States, there are between 200 and 400 pages, words per page. Approximately 300 pages, approximately 400 words, 120,000 words. Now I'm going to ask you in a moment to turn to any page you want in the book, and when you do, I'm going to ask you, please, to silently scan down that page for a word. However, what I'm going to ask you to do, please, for today's purposes, I'm going to ask you to scan for the biggest word, the longest word, the most letters, the most syllables. The reason, notice I don't ask why. Remember, we avoid the words why and but, because why asks 5 questions at one time: who, what, when, where, and how, and that's overwhelming for patients, but negates all that came before. I'm going to ask you to look for the biggest word, the longest word, the most letters, the most syllables, because that will make this the most impressive. If you're not happy with the page to which you turn, you may switch to a different page. And if you find yourself conflicted, and now we know what that is, having had psychiatry, and you find 2 words, you may select 2 if you so choose. And then once you've found 1 or 2 words, I'm going to ask you, please, to remember them and to point them out to your colleague to your right. Please do not verbalize it as I do read lips. And once you all have the word or 2 words, I'm going to ask you, please, to tuck them into your memory, commit them to memory, and then I will take the book back from you. Are we good? Excellent. I'll take the book back, or you can just set it right there because I'm going to step up. May I hand you this book, Dream of the Accused? Is that okay? I'm just going to have you hold on to that, if you will. And I'm using those on the end only because it's easy access, and I really appreciate it. And what I will do, I will come here. May I hand you the dictionary and ask you to hold on to that? I am going to ask you, if you will, just to say stop at any time. Very good. I want you to look at the first word at the top of that page. I cannot see it. You've got it? And you stop me at 2 page numbers. I'm going to ask you please to look at those 2 page numbers. They're random. I am going to step away in a minute. I'm going to ask you to turn to those 2 page numbers that were randomly selected in the dictionary. Hang on before I'm going to step up here. And I'm going to ask please for you to say stop at any time. I'm having you look at the first word at the top of that page, and you've got it. Very good. We have many words. And we have another book, Dream of the Accused, which reminds us the Royal Road to the Unconscious via dreams, Sigmund Freud. Can you tell us how many pages are in your book?
199.
199. From 1 to 199, approximately, because it's a paperback, approximately 40,000 words. From 1 to 199, what page would you like from 1 to 199?
50.
So 50? Would you please turn to page 50 in your book? And I'm going to ask you, please, to look at the first sentence on the top of page 50. Silently, I'm going to ask you to look for the biggest word, the longest word, the most letters, the most syllables, because that will make this the most impressive. And then I'll have you share it with those around you. And then I'll just have you close the book. Very good. And please remember your word. Now I'm going to ask you all looked at the book. And I'll take your book back. Thank you. Very good. Fatal sins. And did you select one or two words? Two. Two words. And I'm going to ask you, please, to share out loud with us. Not the words themselves. That makes this too easy. I'm going to ask you instead, please, to share out loud just the first letter of each word.
V and an H.
V and an H. Now, V and an H don't tell us anything. However, they are an analogy to what we do in practice. When patients present to us, we get a piece of information from them. The first letter, as it were, in the first appointment. And we put that into the chart. And so the first day of the chart, we may get a letter V. And the letter V, the next time they come, we get another letter, an I. And then a D. You see, the unconscious mind goes to a word that has meaning to us. That's right. And what you've pointed out with that first word is that the chart becomes a photographic album of that patient's medical, oftentimes social life. And you see, we get pictures, although it's living, because the first word you selected is V-I-D-E-O-C-A-S-S-E-T-E, video cassette. Is that correct?
Yes.
Thank you. And you see, the second word you were thinking about reminds us that when patients present to us, especially with depression, we want to be certain that we have available for them an H-A-N-D-K-E-R-C-H-I-E-F, a handkerchief. Is that correct?
Yes.
Thank you. Thank you. And in the back, you selected a word at random from a book that reminds us that we want to document what patients tell us. And we want to document as best we can verbatim, so that if someone else comes to the chart after us, they're not working off our opinion, they're working off the raw information that the patient provided, so they can form their own opinion because you're thinking of the word said. Is that correct? And we have someone right now holding a dictionary. Please hold on to that, because your colleague next to you looked at a word that reminds us that when patients present to us, they present fearful, they present anxious. And it is our task to put them at ease, to establish rapport, task one. And then to help them feel better, so that when they leave, they don't feel crumpled. Is that correct? We now have the dream of the accused, the dictionary. The dream of the accused reminds us that we may be seeing patients who are presenting with a criminal history. We may be even looking at someone who has antisocial personality disorder, as we discussed in class. Dream of the accused, you all selected a word at random from a page that was called out at random. And the word that you all are focusing on right now reminds us that when we engage in therapy and treatment, we have to be flexible. Because all too often, we have to make for our patients an ACCOMM, an accommodation. Is that correct? And the dictionary. May I see who's holding the dictionary? Absolutely. And you turn to two pages that were selected at random by someone else. Is that correct? You're looking at 4 columns in that dictionary. Column 1, 2, 3, and 4. 2 on each page. 4 columns of defined words. And now I'm going to ask, if I might, I I'd like someone, please, will you give us column 1, 2, 3, or 4? What column would you like?
Column 1.
Column 1. I'm going to ask you please to look at the top of column 1. There's a bold print defined word, is that correct? At the top of column 1. And I want you please to focus on it. And as you concentrate on it, it reminds us that when patients come to see us, they are coming to their medical home. They are coming to us to provide care and service. We are providing for them a safe place. And in fact, you are looking at a word that reminds us of that because you're looking at the word D-W-E-L-L-I-N-G, dwelling. Is that correct? Thank you all very, very much. Wish you all good luck on all your future exams. Please have a great weekend, and thank you all again for the privilege, pleasure, and honor of being asked to present to you all at Psychiatry. Thank you again.